I have many questions about condoms. Like, what's the percentage of me not having a baby?
So effectiveness rate.
Yes.
Right. So effectiveness rate, it's about 97% effective, typical use, okay, and it's about 98% effective with perfect use.
So if I use 2 condoms, would it be more effective?
So that's actually less effective. What happens is when you have 2 condoms, the heat created between the 2 of them causes the condom to break. So there's no lubrication, it causes the condom to snap.
So do they come in different sizes?
They do. For the most part, there's about 3 sizes in most pharmacies. There's a regular size, which is basically like the condoms that we give out here at the health center. They're very standard sized. They do fit most men. There is also like magnums, for example, which some people prefer. But ideally, you want a condom to fit snugly on your body. If it's too loose, then the sperm can come out of there. And so again, it needs to be snug. It shouldn't be very loose. The 3rd size is actually a slightly smaller size. You want to make sure that if you're using those kinds, it's perfectly fine. Make sure it's not too tight, okay, because it could cut off circulation. It could just be really uncomfortable.
So what if it doesn't feel right?
So usually if it doesn't feel right, it'll mean one of 2 things. Either you're allergic to the latex in the condoms or you have the wrong size. But like I said to you, most people fit in, the normal size. But when people have allergic reactions, they'll basically start breaking out in hives. It'll get really red. What else can happen? You'll be really, really uncomfortable. So if that happens, you want to stop using latex condoms and you want to use either lambskin condoms or polyurethane condoms. And you can get prescriptions for both of those at the health center as well. Alrighty, Caesar, so before you leave, I'm going to go ahead and show you how to actually use one. And you can ask me any questions as I go through it. This is the condom demonstrator. I know it's kind of funny, so you can giggle. But it's just to kind of help me, okay? Okay. So the very first thing that you do with a condom is you check for air. Okay, and so you just kind of squeeze it together. Can you see that?
Yeah.
Okay. So you want to make sure that it pops up and that it has air inside of it. Okay. The next thing you want to do is check the expiration date. So these expire just like milk, okay? And so what happens when they're expired is that they can break really easily. So can you tell me the expiration date on this one?
No. Oh, yeah. 2017?
That's right. So they take a couple of years to expire, but you want to make sure that someone just gives you one, you find one, you check that first, okay? So once you've done all of those things, you know there's no holes in it, you know that it hasn't expired, you carefully open it. You don't want to open it with your mouth, you want to just open it like this. And so you pull out the condom. There is a right way and a wrong way to put it on. So you want to make sure that it's the right side up. When it's coming out through the very middle of it, that's the right side. When it's coming out the other way, where the condom's on the outside, that's the wrong way. And the reason for that is if you place it on top and try to roll it down, it won't roll down. Okay? What you want to do is make sure that it's this way through the middle, so that when you place it on top, it'll roll all the way down, okay?
And are all of like that color?
They come in different colors, different flavors. There's definitely different kinds, okay? You want to pinch the very tip of it and then place it on top of the penis, then roll it all the way to the base, okay? So all the way down to the bottom. Can you guess why you have to pinch the tip?
For the sperm?
Exactly, to leave room. And that's basically it. While you're having sex, you want to double check to make sure the condom is still there. Once you're done, you carefully take it off. Try not to make a mess because that can happen. And then you just tie it in a knot, throw it away, or just wrap it up in a napkin and throw it out, okay?
But to be honest, sometimes it doesn't feel good.
I know a lot of people say that, and it does feel different, but it shouldn't feel significantly worse. What you should do is use some lubricant. What you can do is put it on before you put on a condom. So just some on the very tip of the penis, then put on the condom, and you could even put some on the outside of the condom to help increase sort of the feeling that your partner gets as well. You want to make sure that you use water-based lubricant. So baby oil, things like that are going to break through.
Don't be silly, wrap your willy!